This is the third in my series of 7 short videos about zero harm. So the objective of zero harm healthcare is to eliminate all patient harm, to deliver care and treatment right first time, to minimise errors, and to ensure that any errors that still occur will not result in harm. In the previous video I defined error and harm and talked briefly about the systems that are needed on the front line to support the drive to zero harm healthcare. The shift from where the NHS is now to zero harm healthcare will hope happen only with 2 fundamental changes. 1. Standardising everything that's done in relation to the safety of patients, bringing safety science to everyone on the front line in a form which they can easily understand and easily use. 2. Helping everyone on the front line to develop a range of zero harm behaviours to enable them to deploy the safety science to the best effect. That can actually be done in a very practical, down-to-earth way. In this video and the following one, I outline the 2 systems required for that change. The word system has many meanings, but here I specifically mean the formal and legally required policy document setting out the requirements for NHS safety management and all that it entails, plus all of the activities that make it a living, working enabler for zero harm and delivering healthcare right first time. The formal version could be a printed policy document, but frontline staff would access it via the intranet, using their workstation or their own mobile phone or tablet computer. The first of those systems is the Patient Safety Management System. The objective of this system is to provide safety standards, procedures and policies for all the care and treatment the organisation delivers. What the safety policy is, of course, is zero harm right first time. This has to be a document developed and written with patients and public firmly in mind. We patients have been excluded far too long from what have become the mysteries of healthcare delivery. Time to include us in how you will keep us safe when we're in your hands. It will set out which job holders are accountable for zero harm from bedside to boardroom. And of course every single staff member is accountable in some measure. There will also be policies for the identification of hazards, the definition of the risks they pose, and the way those risks are to be managed and mitigated. Will include how the systems for the voluntary and mandatory reporting of incidents and near misses will be operated, and also the entire process which patients and relatives will use to complain. That will form a key part of the patient safety management system. Why? Because complaints contain so many vital clues to where the safety defences are being breached and harm is taking place. It will set out how audit, inspection and reporting of performance against the zero harm objectives and right first time will be carried out and by whom. It'll include the impact of changes to the organisation and how the services it delivers will be assessed and managed. How the patient safety management system and its effectiveness will itself be evaluated and improved over time. And how staff will be trained in safety science, and how staff will develop their zero harm behaviours. Hence how the whole organisation will be able to deliver zero harm healthcare and demonstrate the zero harm behaviours as an organisation. 2 appendices should set out as much material in easily understandable language as possible on safety science as it applies in healthcare. That means at least what has been previously known as clinical human factors and team resource management. And every healthcare worker should learn all of this from their first days in medical or nursing school, or wherever it is they learn their professional knowledge and skills. and the second appendix will set out the zero harm behaviour set and how those are to be achieved. In the next video, I'll outline the patient treatment and care quality management system.